Emily has a smile that can light up a room. She doesn't know it yet, but she may have already taken her first important step toward a long and healthy life. Like a growing number of parents, Hannah made the decision to save a small amount of Emily's umbilical cord blood at birth. It's a decision that may provide a lifetime of protection for Emily and other members of her family against rare but life-threatening disease.
I just felt like if I would ever need it and I hadn't done it, what a waste. Why pass up the opportunity?
To take a tissue that you would just throw in the garbage versus provide insurance for devastating illness in the future makes eminent good sense.
Once simply discarded at birth, doctors now know the umbilical cord and placenta contain a rich supply of prolific stem cells. Stem cells are the building blocks of the immune system, the body's unique blueprint for rebuilding an entire blood supply.
The white cells that fight infection, the platelets that stop you from bleeding, the red cells that carry oxygen, and then all of the immune cells that are responsible for fighting infections and diseases. All of these derive from a common ancestral stem cell.
Cord blood stem cells saved at birth can be critical later in life in the treatment of a growing number of life-threatening diseases. They can rebuild a cancer patient's bone marrow and immune system destroyed by chemotherapy or radiation.
There are certain conditions where the treatment itself can kill a cancer, but without some type of stem cell therapy, the person may die. So the ability to give them a treatment that would allow their own bone marrow to reconstitute itself can save a life.
Your baby's cord blood stem cells will be a perfect match for the baby if ever needed, and a likely match for a brother or sister.
It was leukemia. I don't know how I got it. It just came right out of the blue.
At age 4, Jordy was diagnosed with leukemia. His bone marrow was destroyed by radiation treatment, but doctors transfused a small amount of cord blood stem cells in a simple IV to save his life.
It's amazing stuff. It's a miracle in a little bag.
I had bad bone marrow, so they had to give the radiation, which shut the whole process down. And the cord blood was new bone marrow that could circulate to replace the bad stuff.
A bone marrow transplant is the other main source of stem cells, but an unrelated bone marrow transplant appears to have a higher risk of rejection than cord blood. They are far more expensive, and finding a bone marrow match can be extremely difficult. The more ethnically diverse our families, the harder it is to find a match. For Jordy, whose mother is Irish and father Jewish of Eastern European descent, a bone marrow match could not be found.
The greatest advantage of umbilical blood, cord blood, is that it would provide the individual an immediate source of an identical match in the future if necessary.
This was our miracle. This was our needle in the haystack that we were looking for. And there it was with his name on it.
Want to see the pretend alligator that's in the bushes?
Jordy is now healthy, cancer-free, and like most little boys, hunting for wild animals in the yard. Cord blood stem cells are now used to treat a growing number of life-threatening diseases, leukemia and other cancers including lymphoma, severe anemia, some immune disorders, and other genetic or inherited disease. Cord blood stem cells are used in gene therapy, revolutionary treatments where stem cells can be armed to go into battle against disease.
With each passing year, it appears that the advantages are becoming more and more apparent. There's a great deal of excitement among physicians and scientists about the possibilities of umbilical cord stem cells.
Family Cord Blood Services is a subsidiary of the California Cryobank, a respected pioneer in the field of cryopreservation, carefully processing and freezing living cells successfully worldwide for more than 27 years. At Family Cord Blood Services, our experts can plan and prepare with you for cord blood collection before your baby is due. The collection of cord blood carries no risk to the mother or baby, is painless, and takes just a few moments to perform. Shortly after your baby is born, the doctor draws blood from the umbilical cord, usually while waiting for the placenta or afterbirth to be delivered. The cord blood is then sealed, resealed, labeled, and packaged for shipping to Family Cord Blood Services, where it is carefully processed and preserved.
Until hopefully they never need it. But if they ever need it, it's going to be one of the most thankful gifts any medical technology could give them to save their child maybe even to save themselves.
Just knowing that there are some pure cells that can help her in the future if something happens. I mean, who knows what it's going to be used for in the future? I don't know. Who knows what's going to happen to her, but at least I've done something.
The decision to save cord blood through Family Cord Blood Services should be made before your baby is due. Discuss thoroughly with your physician or midwife and incorporate it into the birth plan. Here are the simple steps to remember. Family Cord Blood Services will provide you with a collection kit that will include all the necessary items for cord blood collection, labeling, and shipment. You will need to bring the collection box with you to the hospital or chosen facility on the day of the birth. Your doctor or midwife will take over the collection process from there. As soon as the cord blood is collected, a pre-assigned courier service must be contacted to pick up the cord blood for immediate delivery to Family Cord Blood Services. The 800 number for the courier service is conveniently located on the label of the collection box and should be called as soon as possible after your baby is born. Cord blood stem cells are a rapidly unfolding success story whose benefits and limits are still being weighed, but a growing number of doctors and parents are convinced that simply saving what was once considered medical waste may now hold tremendous promise, a powerful family ally against rare but life-threatening disease.
I guess what I would advise anybody who wonders if this is the right thing is for them to come on over and spend some time with my son. I can't even remember all the things he couldn't do. Today, there is nothing he can't do. If I had it to do over again and I could do that and it cost me $1 million, I'd do it in a second.
We want to be the best. We want to be the best in terms of safety, of quality, of effectiveness, and accessibility and service to the physician and the parent or child that may store their cord blood with us.
To contact Family Cord Blood Services for more information or to arrange for cord blood collection, the toll-free number is 1-800-400-3430. Or you can visit us online at www.familycordbloodservices.com.
Fifth generation.
Saving your baby's cord blood is a decision that can be made only once in a lifetime, and that's at the time of birth. It's a decision that can preserve the remarkable healing power every child is born with.